Hi, my name is Blaise Sanchez, and today I'll be discussing this section with Antonio Esteranda on the Centurion Olympics. So this portion is going to be on exercise. And so our overall goals as a group would be one, to be able to recognize our families and friends, use the restroom on our own, lift groceries and objects by ourselves, swim, cook, and chew using our teeth. So the four main goals we're going to focus on today is using the restroom on our own, lifting groceries and other objects, swimming, and cooking. So first off, we want to go over exercise, and what I want to focus on right now is Wolff's Law, which states that bones will adapt to the stresses or demands placed on them. So it doesn't mean that you have to go out there do 500 pounds, 5 pounds, 20-pound dumbbells, kettlebell. Those are still good. So light weightlifting will help strengthen the bones, keeping them from easily breaking, and physical activity will improve the skeletal resistance to fracturing. So when we fall, a lot of times when we get older, a lot of people are always worried about breaking their bones. But what Wolff's Law states is the more force we place on them on an auxiliary load, the stronger that the bones will become, which will make them this bone density better, stronger. And then the balance will help us fall. Regular exercise will train our muscles and bones, and therefore help keep us living independently, and then it'll help reverse some of the damages of osteoporosis. So in two different studies, one done on women premenopausal and one done postmenopausal, it showed that physical activity helped in maintaining bone density, which will help keep us from developing osteoporosis and help strengthen our bones, help keep that bone density high. Okay, so here's a very simple exercise program, and a very easy myth, or some myth that a lot of people like to say out there, is they never see a lion, a tiger, or any animal of prey stretch before they hunt, which is actually very false. Whenever you see any animal of prey, any canine, any animal at all, as soon as they get up, the first thing they do is they stretch. So it's we as humans are the ones that are actually abnormal, where we, as we get older, we don't stretch as often as we should. So a daily full body routine should be about 3 to 5 times a day, with about 3 to 5 exercises in it each time. So it doesn't have to be you don't have to always have a high heart output or increase of VO2. What we could always focus on is doing nice, easy 30 seconds or 10 rep exercises. So right here is a good one. A morning exercise would be a side neck bend, relax that neck, shoulder roll to help with our posture, strengthen our back and stretch our pecs, knee to chest, so that way we can stretch our back. Side core bend with some dumbbells, so that way we can warm up that core and strengthen that core. And doing a light dumbbell squats, nothing too heavy, maximum 40 pounds, 50 pounds if you can, but 20 pounds is good enough. So that's a simple full body workout activity that you can do every day, so you don't have to be like this older gentleman in the bottom left who's lifting what looks to be about 500 right there. So anywhere from 30 seconds to a minute holds, or anywhere from 10 to 30 reps should be about your goal. And you should stretch about 3 to 5 times a day, depending on how severe your ailments are. Because if you only stretch once a day, that's 23 more hours, muscle gets sore and tight. So the more you stretch throughout the day, looser you're going to be, taller you're going to stand. Most importantly, less pain you're going to have. Okay, so we want to focus right now in this section is a strength and muscle imbalance. So we need to focus and remember that our muscles can only pull, they can't push one another. And our body is made up primarily of levers. So if one lever is weak, the other is weak. So primarily most of our levers are like our bicep and our tricep, where it's a level type 3 lever. So when one bends, the other one flexes, and vice versa. So some people suffer from what's called referred pain. So what referred pain is, if we look over here into the left where it says back pain, so if you have lower back pain, specifically lordosis, where our hips are anteriorly rolled forward, that means that our hip flexors are pulling on that lower back, because we want to take it and remember that that psoas muscle specifically originates in that hip, attaches to the hip pointer, and then attaches to the 12th rib in the lower back. And so it's primarily a hip flex. It's a hip flexor movement, but I like to call it our sitting muscle, because when we sit down, that one flexes, pulling on our lower back. So if you're only focused on one muscle, but not the other muscle, then it's going to hurt ourselves. I like to call it the Genghis Khan form of treatment. So we only focus on the back. That means that we're loosening up the muscles so that way they can get pulled further. But if we're focusing as well as those hips, then we can untie those knots so that way we're not being pulled. Because what Genghis Khan used to do is use tie people up to horses, how the horses would run in 4 different directions. And so remember, we're not loosening up those muscles to get pulled. We need to loosen up the knots so we're not being pulled. Okay. All right. Balance. So as we get older, one of the biggest concerns is falling and breaking bones. So to prevent that, we need to focus on balance so that way we can catch ourselves. A lot of times when we fall, we have a tendency to reach out with one foot. And to prevent ourselves from falling in that instance, we need to be able to balance on one foot. And if we can't maintain our body weight on one foot, then our leg is going to give out and we're going to fall, which could lead to a higher likelihood of breaking a bone. Going up and downstairs. So going upstairs is predominantly leg strength, but going downstairs is about balance. So we need to be able to do a single leg squat. And so that way it's easier for us to go down stairs, which will help us to maintain independent living. And then being able to lift as well as sitting and standing are also affected by our balance. Lifting objects, we need to maintain core, not core strength, but core balance, maintain that we're not too far forward, too far back, so that way we won't fall in either direction. Same thing when we're sitting or standing, we need to be able to balance on our legs so that way we can get back and up, and that will help us with using the restroom with ourselves, sitting down, going to dinner, and whatnot. Swimming. So swimming exercises elastics, hypertension effects and improvements in vascular function in previously sedentary older adults. So we found as older adults who weren't exercising and then started swimming regularly actually saw better health. So what this shows us is that swimming will help improve our heart capacity. It also will help improve our lung capacity because we got to hold our breath to stroke and swim up and down. So that will help increase our breathing, improve our breathing, our VO2 max, and it will also increase our muscle strength because as you can see in the bottom left-hand picture, depending on the different type of strokes you're using, but predominantly most of the strokes are using a lot of the body movements, not just your arms, but also your core and your legs. Okay.
So in addition, having a strong core improves balance, flexibility, and mobility, meaning that having a strong core will help us to have a strong back. So this means that if our core is weak, then our back is weak, since the core muscles have to pull on the back. This is especially evident when we're lifting our torso, since our core is primarily engaged and it pulls on our back for support. So the weaker the core muscles are, then the more they have to pull on the back. And this means that the muscles are being strained as well as the spine, and this leads to back pain. Thus, having a strong core and a strong back prevents from pulling on them too much. And we can liken the core and the back to the pillars of a bridge. So say, for example, if one or the other falls or is weak, then the other must follow. And the bridge that represents the muscles that connect the core and the back will collapse or fail to function. We also need to strengthen in multiple directions because we're moving in different directions as well. People think of workouts as just planks or, working at the core, but there's so much more to that. And this can really help during cooking because we're using muscles for rotation. So like, for example, when we're moving left to right, as well as getting ingredients. In addition, when we're like reaching for things above or below us, we're pulling on our muscles such as our obliques, as well as maintaining balance. So doing social activities such as swimming classes, hiking groups, or boxing classes will help encourage the elderly to do their exercises as they're working out in groups. And having goals and small competitions that are associated with these groups will help keep them motivated as well. In addition, this motivation can help to maintain their social bonds and help them to have a consistent workout schedule. So this will help them to remain in their social groups, and prevent depression. So exercise is vital as we age due to the loss of muscle strength and bone mass, which is a normal condition, and it's almost inevitable. So sarcopenia or muscle loss, as well as osteopenia or bone loss, are commonly found in the elderly, and this is because of the imbalance between anabolism and catabolism of muscle tissue and bone density. So the both sarcopenia and osteopenia increase the possibility of clinical problems such as impaired locomotive function, compromised balance, and risk of osteoarthritis. So for example, growth hormones act with protein destroying enzymes to keep the muscles steady through a cycle of growth, stress or injury, destruction, and then healing. However, during the aging process, the body becomes resistant to the normal growth signals, and this tips the balance toward catabolism and muscle loss. So with this muscle and bone mass loss, mobility and movement is limited, strength to hold the body decreases, and therefore this impacts overall performance in daily life. So more specifically, the overall performance and the quality in our daily life decreases, which means that we have to rely on other people more often. In addition, cognitive decline and memory loss also comes with the aging process, with the most apparent effect being the epigenetic mechanisms that determine gene expression being negatively affected. So more specifically, these mechanisms are DNA methylation, histone modification, and nucleosome remodeling. Malfunctioning of these mechanisms result in a decline in activity-dependent transcription, synaptic plasticity, adult neurogenesis, learning and memory, and it gives rise to Alzheimer's disease, dementia, and other degenerative brain disorders. So in conclusion, exercise later in life improves our quality of living and bone density while meeting our personal goals that we just went over. Being able to sit down and stand will help us to use a restroom on our own. Having a strong core and proper balance will help us to lift objects, cook, and maintain an active lifestyle. Last but not least, exercise improves cardiovascular health.